all right. My goodness. We are on the Life and Health Show today on Dr. Oteng's channel. And I'm pretty sure you are ready to roll just as we are. All right. Today is a beautiful day, a little chilly where we are, but we cannot complain because we are alive. We are on the live and we are alive. All right, come on, man. That's the most important thing, right? And today we have a wonderful show, and hopefully we're going to have a good time together. So if you are joining us and you are watching from TikTok, you can join and keep watching us here, or you can switch to our YouTube channel where you can see our slides that we're going to be presenting using the same name that you can see on your TikTok feed. And also, if you are joining us any other way, just do us then. All I'm saying is just click the share button, and let's roll together. All right, honey, what do you think?
Yeah, I think we are happy to be here and we are ready to roll with you. So if you want to say hi and share the stream so that more people will join us and we all learn together, we will appreciate that.
That's what's up. That's what's up. Come on, man. Share the screen and let's grow together. We are not people who enjoy being alone. So we always want to have more people. So just click the share button and let's roll together. But that being said, we have a very important topic today. Last week we talked about cancers, and specifically we talked to an oncologist about colon cancers and colorectal cancers and how to prevent them. And that was a very important information we shared on the live. And the video is still on the live, so if you missed it, don't forget to go back after this one and binge on that show. It's about an hour and a half long, but it's full of info. You won't even know you are watching for an hour because of all the good pieces of information that we received from our Dr. Juliet Appiah Kwanzaa. All right. Somebody thought that she was actually talking from Ghana, but no, she is in the USA. She is actually a resident in Missouri, and where she practices oncology. All right. For today, we are going back to season 5 of hypertension treatment and hypertension information, basically. And today it's a fun one because it's something that, especially in our practice, we see that hurts a lot of people. And we want to just use this time to talk about this. And if you are joining on YouTube, you can see our slide. We're showing it's OTC meds and blood pressure, how over-the-counter medications affect your blood pressure if you are using them. Some of the questions we answer on a daily basis when we are working. And we want to share that info with you, and hopefully you'll give us a break when you come to the pharmacy. You won't ask those questions. If not, we'll be happy to still talk to you about those. But we just want to make sure that you have this information down because we don't want your blood pressure to creep up when you are thinking you are taking care of your cough and colds. So that's what we're going to be talking about throughout the show. And so make sure that you have questions, you ask, put it in the chat. If you are joining after the replay or if you watch it after the live, you can still ask your questions or comments, and we'll be able to see them and react to them accordingly. So that's our topic for today. With that being said, we're just going to go straight into it. So when we say over-the-counter stuff, let's just throw a little bit of light on that. What does that mean, over-the-counter?
Yeah, so over-the-counter, where we are, it's more like you don't need prescription to buy them. So here we have it in two parts. You have things that you can just grab on the shelf that you don't need prescription. So some people will self-diagnose or think that they have something, then they'll come over to the pharmacy and buy things on the shelf. Basically, anything that you can buy on the shelf without prescription is deemed over-the-counter medications.
All right. So anything that you can get without having to see a doctor for a prescription is what we call over-the-counter medication or remedies. And some of these over-the-counter medications happen to increase your blood pressure. And so we're going to be breaking down. It's going to be a very informative show. If you stick with us, you will learn a lot. When we're talking about that, we're discussing the show before we start. We're like, students can actually take an exam after this and pass. Come on, man. Yeah. So it's a wealth of information we're going to share. We're going to still try and run through it, but definitely be ready to receive a lot. And that's what we're going to be talking about: over-the-counter preparations and your blood pressure. So with that being said, I think we can go on to our slide. And as we have said, actually the topic is a little longer than that. It is OTC meds and high blood pressure, what is safe and what to avoid. So OTC meds and high blood pressure, what is safe and what to avoid. That is basically what we're going to be talking about. And so with that being said, let's see our show outline. We're going to be focusing on, you want to start that?
So we will talk about pain relievers, OTC pain relievers, just over-the-counter pain relievers. Then we continue with cough and cold remedies. So like when people have cold, cough, sneezing, all that, there are medications over the counter that they can take. Sometimes you don't need to go see your doctor. They are available at the pharmacy. And we've realized that some of these cold and cough medication can really affect your blood pressure.
All right. And so from there, we will go to the next item, which is going to be talking about the energy and diet supplements. When we talk about energy supplements or energy drinks that some of you know, some that come to mind because of their popularity. I'll give one hint. Red Bull. Come on, man. That is Red Bull, right? We're going to talk about those as well as some diet preparations for weight loss and stuff that may affect your blood pressure. And then from there, we will go to other drugs and diseases that may also affect, that your OTC medications may affect and also hurt your blood pressure. Or should I say, like, other drugs that can affect your blood pressure, as well as diseases that can also affect your blood pressure if we have more time.
And we will continue to show you how you can read the labels on the over-the-counter medications so that it may click so that you may deem it necessary to ask your doctor or your pharmacist before you take any medication, especially if you are on prescription drugs and you have something going on. We will try and help you decide whether it is important to talk to your doctor or your pharmacist before taking any medication over the counter.
All right. So that seems to be almost everything. And from there, we'll do some comments and we'll talk about next week. And we end the show. We're also going to talk about something that is fun to talk about. Our channel got monetized, and want to also show you how you can become part of our channel in terms of supporting us to reach more people, help us buy equipment and other stuff that will ensure that we are able to do this and do it for free. Or come on, man. All right, so that is our outline for today. And with that being said, we can move on to our next slide, what we call the NSAIDs, over-the-counter NSAIDs. And you want to start with that while I fix this?
Sure. So NSAIDs are special drugs that most of us know a lot about. So NSAIDs is just an acronym. Mm-hmm. The NSAIDs is just non-steroidal anti-inflammatory drugs. So these are drugs that are found over the counter, and mostly people take it for pain, inflammation, and for fever.
All right. Okay, yeah, so that's the easiest way. She broke it down for you. NSAIDs are the non-steroidal anti-inflammatory. So, I mean, most of you know what they are, especially when we start mentioning the names. But we have to make it look more hard so that you can trust us, right? But yeah, you know what they are. Trust me. We're going to give you some examples of what they are. But literally, what they do is what she said: they help with pain, they help with inflammation, and they help with fever. And when you go to most places, these medications are on the shelf. You don't need to see a doctor for them for the most part. In the US, it's a little more controlled because we only have, I think, only about 2 or 3 that you can buy under different brand names. But when you move outside the United States, in Europe, Africa, Asia, and South America, and other places, you can buy almost all of them on the shelf without a doctor's prescription. And that is where it becomes dangerous if you don't know they are going to bother or affect your blood pressure, especially if you have hypertension or if you are thinking about protecting yourself getting high blood pressure from getting high blood pressure. And so that is that. And let's see if we can go through the list of them. And this is a comprehensive, I should say, list. In fact, one of them is actually potentially discontinued in the US, but we just wanted to include everything so that if you are watching from another place outside the US, you will see that we have listed them all here. So starting from the top, I will start with the first 3. Ibuprofen, which is the common one. Most of us in the US, we know it as Advil or Motrin. And then the second one, that is another popular one, is what we call Naproxen or Aleve. Most of us in the US, in another country or in different countries, they have different names for it. That is why talking about the reading labels will come handy. But definitely, these are very common in the US. As a matter of fact, the endomedicine is not over the counter in the US, but it is an NSAID, or it is one of those classic OTC medications in other places. I remember my grandmother, when she was alive, used to send me to buy this for her all the time for her arthritis. And she had hypertension. Unbeknownst to her and me, we were just buying it every time. Grandmother would say, boy, go get me my Indocin. And she said so well. And later on, after I went through school and got this education, and I knew, oh my goodness, I helped my grandmother and herself, die of complications of hypertension, because she was using this all the time. So that is another popular one. In many places, you don't need a prescription for it. So those are the first 3, and give you the next 3.
I think those are the next 3 over here. They are all prescription too. And other places, you may find it over the counter. So we have the diclofenac, which is also known as the Voltaren. We have the celecoxib, which is the Celebrex. And we also have the meloxicam, which is the Mobic. All these 3 are prescription in here, United States.
Yeah. All right. So all those 3 are prescription medications in the US. And then the next 3 are also prescription medications. And the 8th one, I think, may have been discontinued because I haven't seen it in a long time. So meloxicam, as she said, there's Mobic. And then the next one is ketoprofen or ketoprofen. Depending on where you were born, you say ketoprofen, paroxicam, and aspirin. Now, aspirin is a first NSAID, I should say. Some people don't want to call aspirin as an NSAID, but technically it is the first NSAID. It is from aspirin that most of these NSAIDs were derived. So it is the first NSAID. So all these here listed, 8 and the aspirin, can all potentially affect your blood pressure in a negative way, or they can raise your blood pressure. All right?
So how many of us, when we have headache or we have muscle pain or ache, will reach out for ibuprofen or Aleve? A lot of us will just reach out for these medications. So today we are learning that all these medications can affect your blood pressure. So if you're somebody that has been diagnosed with blood pressure, you have to be extra careful when it comes to these medications that are labeled NSAIDs. So some of the medications, I think the ibuprofen, the lower dose, you can find it over the counter in the United States. But the higher dose, which is the 400 milligrams, 600 and 800 milligrams, you need prescription for that. And sometimes too, you may have been given this medication, is sitting down. You don't really need it because all that you have is just plain headache, But because you have ibuprofen 600 milligrams or 800 milligrams, or because you want a quick relief, you reach out for these medications. So if you are at a borderline or you've been diagnosed with blood pressure, when it comes to these medications, you have to be extra careful.
You have to be extra careful. Come on, man. You have to be extra careful right there. No, we're talking about this. We like the. I at least I do. I don't know about Gifty, but I like the sound effects for everything, right? Making it more interesting and more fun. But we're talking about some serious stuff. Some of these things can hurt your blood pressure. Some can hurt your heart health, and not only that, we are just limiting this show to blood pressure, but these can cause ulcers. They can cause kidney disease. If you have kidney failure or any sort of kidney, insufficiency or renal insufficiency, these can make things worse. Very, very dangerous drugs if you take them without a doctor's direction or pharmacist's direction. So just be on the lookout, especially if you are worried about blood pressure going up, or you have uncontrolled hypertension, or you have family history and you are dealing with difficulties in controlling your blood pressure. Then you definitely have to be careful with some of these. So that is why we want to bring these to you. And as we said, in the US, only about 2 or 3 of these may be purchased over the counter, but in other places you can find every one of them on the shelf. I've had people come to me from South America asking me to buy this because over there it is on the shelf, and in the US it's not. So if you depend on where you're watching from, you still have access to this, whether by prescription or by your own, going to the store and picking it up. So that is something we have to be careful with. Now let's move on, right? All right. So how do these NSAIDs affect blood pressure? How do they affect blood pressure? We can start.
Okay, so we have a hormone called prostaglandins, right? So prostaglandins are supposed to be a dilator. It dilates in our system. So when you take these NSAIDs, it inhibits the production of prostaglandins in your system. So when it inhibits that, it means that your blood vessels are not going to be well dilated. It's going to constrict it. And when it constricts it, it increases your blood pressure. It also helps in
Sodium
release,
water.
right?
Sodium.
Sodium and water release. So if it's inhibited, then it means that you are not able to excrete sodium, excess sodium and fluids. And in that case, you are going to increase the blood volume and your blood pressure increases.
All right. So that's why I say that you can just take it from us to the bank and say that NSAIDs or ibuprofen, naproxen, and all those good stuff that we listed on the previous page are going to raise your blood pressure. But if you want to be more thorough, this is where we're teaching you some pharmacy right here. It inhibits prostaglandins. And as Gifty said, that is going to, when we discussed hypertension in the beginning, we told you that one of the reasons for hypertension happening is because we withhold salt. And when you withhold salt, you have to withhold water, and that increases your blood volume and your body space, or your pipes, your tubes. They are fixed, they are constant. And so if you're increasing the volume, then somebody's got to be doing a lot of work, and that is the heart. And so your pressure goes up because volume has increased, and yet the place to travel to has not. And so this is one way that the NSAIDs, these OTC medications, affect your blood pressure by inhibiting the prostaglandins, which in turn will stop you from dilating. Dilating, let's break it down. Dilation basically means your vessels or the tubes through which your blood flows become relaxed. So if you have a lot of prostaglandins, you have a relaxed vessel. You have relaxed blood vessels. Your arteries are relaxed, and so blood flows without much resistance. Yeah. But if you inhibit prostaglandins, then this is the substance that was making you dilate or relax your vessels. So if you are not producing much or stopping the work of prostaglandins, then obviously you're going to constrict, you're going to close up your blood vessels. That will increase your pressure. And that is how NSAIDs or your Aleve and your Advil and your Motrin and your Naproxen and your Ibuprofen
Ibuprofen.
and all the other ones we mentioned, Piroxicam, Mobic, or Meloxicam, that's how they are affecting your blood pressure. So that's the first one, inhibition of prostaglandins. I think there's another one we
Yes.
put on the line. Okay, let's see. The other one is that they also affect your kidneys. So NSAIDs themselves, or the ibuprofen, and these other ones we mentioned, the Aleve, the naproxens, the peroxicams, or the meloxicams, or the ketoprofens, all those NSAIDs that you may be able to find over the counter just for your little cold, just for your little headache, they are going to affect your kidneys. As a matter of fact, if you have a renal insufficiency or if you have a compromised kidney, you should not even dare take these things because they are going to make things worse. And when they affect your kidneys, they obviously affect the excretion of salt and water, and so your blood pressure will go up. And so that is why we have to be careful when we are grabbing stuff. The fact that they are available for you to buy doesn't mean you should just buy them and use them all the time. You have to seek the help of your pharmacist or the help of your doctor. With that being said, then I think there's a third one, and that is these same medications affect or interfere with other medications. Want to take that one?
Yes. So we have, if you've been diagnosed with blood pressure, you are taking blood pressure medications. So at this point, you have to be careful when you add any OTC medications. So sometimes your doctor may advise you that when you are coming to the hospital or when you are coming, you have to write down all the over-the-counter medications that you're taking. The reason being that the NSAIDs that we are talking about can interact or can interfere with your blood pressure medication. So it being over the counter doesn't mean that it's safe for you to just take it, especially if you are taking high blood pressure medication, because it's kind of it doesn't make the blood pressure medication to work as well, especially the medications that use the kidneys, the diuretics and the ACE inhibitors and the ARB inhibitors. Those specific medications are not really safe to be combined with these NSAIDs. So you have to be careful. Sometimes the doctor may ask you to take it all right, but he may suggest that take it for just 3 days and stop. And if you are not careful and you keep taking it every day for the long period of time, it's going to interact with your medication and you realize that your levels are not well controlled. Then you wonder why your levels are not being controlled. It's because you are taking something over the counter that is inhibiting the effectiveness of the medication that you are taking. So you have to be careful when you want to add on any medication to your high blood pressure medications.
Oh, come on, man. Come on, man. That's it. You have to be careful when you are adding blood pressure medications. You have to be really, really careful because you never know. You never know what you are taking. I mean, in this case, we are showing you what you're taking if it is not the right one, right? But obviously, the drug interactions are profound. You can be taking hypertension medications and your pressures may not be going down, and the reasons that may be is that you are also taking high dose ibuprofen for your arthritis. You've been taking Aleve or naproxen every day in higher amounts, and your doctor probably doesn't even know. And no wonder your pressure is not going down because these medications are interacting with your medications. They are, stopping the work or the effect that your kidneys are supposed to produce because they are being counterproductive, to be short. And so we have to be very careful when we are getting stuff over the counter. And then you also mentioned the diuretics. All right. So those are the three main things that OTC medications for pain may do to affect your blood pressure. Now, with that being said, let's see if we can suggest something that they can use for pain. instead of these things. All right, so let's come to that now. So if you are worried about, you know, your blood pressure going up and you need something for pain, what we would suggest, the first thing is that call your doctor. Come on, man. That's the first thing you got to do, is to call your doctor. Let your doctor know that you need something for pain. And if your doctor knows and they know you are being treated for hypertension, they will be in the best position to tell you which ones to take. But as you know, after that, if you can get hold of your doctor, or if your doctor suggests something and you still need another, another help at the pharmacy, before you grab anything, make sure you talk to your pharmacist. Come on, man, that's what we are here for. Make sure you talk with your pharmacist about whatever you are buying. It's very important. And then, that being said, if you have no pharmacist around, you are home, and you got a bottle of pills at home, you have pain, the doctor's office is closed, the pharmacist is closed, and you have nobody to ask, then what we would ask of you is look on the bottle and see if you have something called acetaminophen, or what other people call Tylenol, or what other people call paracetamol, or what other people call some other names we don't know. Come on, man. Yes, as long as the active ingredient is any one of these, is these ones we are talking about. It may have a different brand name, but if it is acetaminophen, then you know that those don't raise your blood pressure. Those don't affect your pressure or withhold water. They don't inhibit prostaglandins. They don't, inhibit your kidney function. They don't really, interact with your blood pressure medication. So you can never go wrong with taking something called acetaminophen when you are in doubt.
You have to tell the pharmacist. Most pharmacists are trained to ask more questions when you walk up to them, to ask them, "What I have headache. What do you think is the best medication for me to take?" But if they don't ask, "Are you on any other medication? Are you taking any other medication? Have you been diagnosed with this kind of disease?" If they don't ask, just bring it up. "Oh, I take something for blood pressure. Do you think this one is okay for me to take?" So that the right medication is recommended. There are some medications out there that when you have a condition or an indication, they is specifically made for people with high blood pressure. And some medications are specifically made for people with diabetes. But if you just grab anything because you have headache, you may cause an interaction with your medications. So it's very important to be
Very thorough, basically.
thorough, like give more information when you are, because some people have been diagnosed with other diseases that the pharmacist may not be aware of. And you said that we should call the doctor the first. And sometimes it's very hard to get hold of your doctor, and sometimes it will take several days or so before they get back to you. So sometimes the pharmacist is very accessible easily. You can get to them quickly. Just give them all the information about you so that the right medication will be suggested or recommended for you.
Oh, come on, man. That's what's up. That is it. That's it. We just want to make sure that we don't want to take, the place of your doctors all the time. That's why I mentioned call your doctor first. But most of these things you can just ask your pharmacist, especially if you are going to be willing to come up with the information that he or she will need to make the decision. If you just go and you don't say anything, they don't have your chart. And unless you fill your prescriptions there, they may not be able to see what you're treating already, what disease you already have. But if you are able to come up with all those answers, I have this condition, you don't even have to know the medications you are taking. As long as you can tell them what you have. "Oh, I have blood pressure problems, I have diabetes," then they can have that enough information to recommend the right things for you. All right. So if you can do that, then you probably don't even need to call your doctor, because sometimes when you call your doctors, they say, I've seen people come to me all the time and say that my doctor says I should come and ask you. Because yeah, they don't have time for that, and most of the time they don't even know what it's on the shelf,
On the shelf.
because they have left school, school for a long time. They don't come to the store to look on the OTCs and stuff. So you just have to have, like Gifty said, more information to give, and we shall be able to help you in that front. All right, we'll go forward.
So you were saying that so the safest one, are we saying suggested is
Oh
what,
yes, the
Tylenol?
Tylenol or acetaminophen, because Tylenol is not everywhere. But paracetamol, depending on where you are, or acetaminophen is the active ingredient, or Tylenol in the US. And there's extra strength Tylenol or extra strength acetaminophen, depending on where you are. It's 500 milligrams or 325 milligrams. Again, there's a maximum you can take per day. This is where the pharmacist comes in to explain to you how many you can take. And if you are pregnant, how many you can take. And if you're on certain medications like a blood thinner, the maximum you can take may be different from any other person. So all these pieces of information are there. That's why it's good to ask a professional. But at least if you are in doubt, if there's nobody to help you, you can safely rely on acetaminophen instead of the other ones. The other ones, you have to be told that yes, they are safe before you do it, because you don't know what you may be treating. You don't know if you have a kidney problem or if you are on the verge of getting a kidney problem, and you don't want to make things worse. And so it's always good to ask first before you do it. But if you don't have any access to anybody and you have to take something for pain, you can't go wrong with acetaminophen for now, unless you have kidney or liver disease. Then, of course, that's also a problem. You can use acetaminophen. So in all these things, it comes to you being upfront with your care and showing us what we know, what we should know to be able to make those decisions for you.
And also, sometimes it depends on the kind of pain that you have. There.
Yes.
Because like if you have inflammation at the joints, sometimes the Tylenol may not work as well.
Yes.
Because I know people that say that Tylenol doesn't work for me. It's only the NSAIDs that work for me. So we are encouraging you to know your condition so that you can pick the right one. So if you have not been diagnosed with blood pressure, you may be okay for you to take the ibuprofen. And if you don't have any kidney disease, it's okay to take it. But how much to take it, you have to make sure that you are following direction. And sometimes too, it may ask you when you're taking the NSAID that you have to take it on full stomach, because it can affect the stomach lining because of the way it's being put together. So those are the directions that you have to follow. So based on your condition, if you don't have blood pressure, and sometimes too, the doctor may say that your blood pressure is well controlled, so it's okay to take it. But the length, how long you take it, is also something that you have to pay attention to. So the doctor may say that at the worst state, when the pain is maybe up to 10, then maybe you can go back to the NSAID. When the pain subsides and go down, then you can change from the NSAID to just plain Tylenol. Because as we know, Tylenol do not have the anti-inflammatory property, right? So it doesn't work as well if your pain is more like inflammation. So we have to be careful how we take these medications.
All right. You don't take it, we'll take 2 shows for this one, because more things are coming up as we go forward. The other thing is, you may not, especially for pain that is due to inflammation, you may not even need to take something by mouth. For example, if it's a localized pain, like in your joint, you probably would just need a heating wrap, or a cold pack, or an ice pack, I should say, or an ointment, a rubbing ointment that you should just massage into that place. All those things may work. And there are also some NSAIDs that are made into cream, like diclofenac gel over the counter, that you can apply locally, and it may help. A lot may not be absorbed into your blood to cause a problem with hypertension. And so it all depends on where your pain is, and also how bad you need it. And I think an important point that I should stress that Gifty mentioned is that if your pressure is under control, I've seen people whose hypertension is well controlled, and because it's well controlled, the doctor still gives them the NSAIDs because they're already under control, because they are taking their medications on point and they are checking it and it's not going high, but they need pain relief for their knee, for the arthritis. And so the doctor may give a meloxicam, or even ibuprofen, 600 milligrams, which is kind of high, but still, because they can assure them that their pressure is controlled, they may still be able to take that medication. So it depends on, the risk versus the benefit and how controlled your blood pressure is. So if you are already taking some ibuprofen, 800 milligrams, and you have hypertension, don't stop it and say that, oh, those guys said that I can't take this. No, that's not the point. If your pressure is controlled, if you are under medication for your blood pressure and it is managed, your numbers are on the goal. Your goal is 140 over 80, and you are at 135, and you need some meloxicam for your arthritis back. Come on, man, you can take that. You could take it, especially if you don't have any kidney issues. You can definitely take it because you are being monitored. Your doctor is watching it. But if it is like, I don't know, and then you just won't go in a store and you pick it up and you buy it because it's over the counter, that is where we say no, you don't. So work with us, your pharmacists and your doctors, and let's direct you as to which ones to go for and which ones not to go for. All right. So stick with us. We're going to finish soon, but we got some important information here. So for the cough and cold meds, the examples that I have, I'm going to list the first two, and then Gifty will read the green ones. The white ones on my screen here is the Sudafed or pseudoephedrines, and then the phenylephrines. There's also there are a few others that we didn't want to include because of time, but definitely the phenylephrine, you can find phenylephrine in Sudafed PE. When they say Sudafed PE, the active ingredient, it may include phenylephrine. And then also you may find phenylephrine in Dayquil. Dayquil also contains some phenylephrine. And the phenylephrine and the pseudoephedrines are the ones that may cause problems with blood pressure. So give to go through the next.
And another cold and cough meds that we have over the counter, we have the dextromethorphan. Normally we call it the DMs. The guanfacine, we have the Mucinex DM. If you go to the pharmacy, you can see those ones over there. And we also have the Flonase or the fluticasone, and we have the antihistamines. So the antihistamines will include the Claritin, the Zyrtec, the Allegra, and which one am I missing?
The fexofenadine.
Fexofenadine.
That's Allegra.
The Allegra. Yeah. So those are the antihistamines.
Trimetern. There's a lot. There's a lot of them.
Yes. Anyway. So those are the list of the cold and cough meds that we find in over the counter. And I think you divided it into two parts, right? So that the Sudafed, which is the pseudoephedrine, and the phenylephrine, which is the Sudafed PE, and the phenylephrine is also found in the Dayquil, right? Those are the ones that will affect your blood pressure. And the green ones, is that right?
The green ones
is the dextromethorphan, the guanfacine, the Flonase, and the antihistamines that wouldn't affect your blood pressure.
Let's see. Let's talk about how they affect the blood pressure here. And then we could probably go back and explain if we need to. So how do they affect your blood pressure? So basically, we summarize them into 3 points. These cough and cold medications or remedies that can affect your blood pressure, they cause vasoconstriction. All that means is that they are going to close up your pipes, your arteries, so that blood doesn't flow easily. So your arteries are not relaxed. And if they are not relaxed, then obviously the pressure has to be high for blood to be pumped through them. So that is the first one. That's vasoconstriction. And the next one is the heart rate. They increase your heart rate, make your heart beat faster, and then they also increase the blood pressure themselves. So those two are two huge ones that they can cause directly by themselves, just the pseudoephedrine and the phenylephrines.
Yeah, and I think the Sudafed and the phenylephrine can also interfere with some of the blood pressure medication, meaning that it's not going to make the medication work as well. So in that case, it's interacting. There is an interaction between the two, and that can affect the blood pressure level because the medication is not working as well because of what you are taking, which is the Sudafed and the phenylephrine.
Phenylephrine. And there are topical ones for pseudoephedrines, and um, they're topical as well as the oral ones. Now, the oral ones are the ones that are really to blame. The topical ones, like the nasal spray, the phenylephrine nasal spray, because it's just localized in your nose, not a lot is absorbed into your blood. So you may not have any issues with blood pressure when you use the phenylephrine. Or there's another one that we commonly call Afrin. That's also one that if you were to take it by mouth, your pressure will shoot up. But because it's localized, they don't cause blood pressure. The only problem is they can cause a rebound congestions. If you use them for too long, your congestion that you were treating, as a matter of fact, if you use them for more than 3 days, it's going to come back big time. And this time, they don't even work. And so that is what they are. Now, with that being said, what can we do about them? Now, what can we do? Now, I know we said that, the green ones are the ones that we really want to talk about. So what are the green ones again? The dextromethorphans, which I think that, I think I'm ahead of myself, right? The dextromethorphans, which I think are the DMs that she said, the green ones that we have listed. If you are coughing, those may help, and those are in the tassins, or whatever medication that ends with a tassin most likely has a combination or a single ingredient of these green ones that we have listed: the stromatophan or guanfacine, or guanfenicin, I should say, not guanfacine. And then you could also use the nasal spray, which this Flonase or fluticasone is a steroid nasal spray, which works pretty good. And again, people are scared of steroids, but this again just local. It's just going to work right up in the nose. It's not going It's not going to be absorbed into your blood, so you don't want to worry about that one. Those will work instead of doing the phenylephrines, which can make you have rebound, congestion. And then the antihistamines are also good because they can dry you up. If you are sneezing all the time and you are coughing, sometimes there's a phlegm in your chest, and especially if you cannot use the pseudoephedrines to cause a decongestion in your nose, then the antihistamines may help because they may dry up the mucus, help dry up the mucus, so you get a relief that way. That is why there's another medication that we usually recommend, Coricidin HBP. We usually recommend that for people with hypertension, and the only reason is that they don't have pseudoephedrine. In place of the pseudoephedrine, they have put antihistamines, which dry up the mucus, in a different way than the pseudoephedrine would have done in the nose.
And with the antihistamine, it also helps with the postnasal drip.
Postnasal drip too. Yeah.
So when you have the postnasal drip, you know that it drips down your throat and that makes you cough. So all that you need is just something to dry you up, and that is gone if you take it instead of going for the strongest medication, and that may interact with your medications.
With your blood pressure. That being said, it doesn't mean that they don't have their own side effects. They also have their side effects. If you take them for too long, you can get constipated, you can get dry mouth, dry eyes, and all those dryness, is as we call them. So basically, you have to be careful. And in everything, moderation. Just use it quickly, and then once you feel better, you taper them off as soon as possible. That is the way to go. All right, so now let's move on to the next thing that we're going to be talking about. And the next thing is, actually, we're doing good on time, energy drinks and diet supplements. These are another great group of medications that people use that may actually increase their blood pressure. Believe it or not, a lot of people don't know. Red Bull and all those other good stuff that men drink just to stay awake, and 5-hour energy drink, all those things. Monster. Oh, come on, man. Now, I've tasted all these before, and if you didn't get enough sleep, or you are tired for some reason and you drink some of this, they wake you up quick. They make you. I've tried them, so I know how they taste. And they wake you up. You get some boost of energy, and then you can do your work, which is what they market them for. Unbeknownst to them, if you do it over a long period, they become also not good for you. So if once a while something happened, you lost sleep and you needed to stay awake at work, or especially if you are driving the school bus or a coach and you didn't sleep and you have to drink Red Bull to stay awake, come on, drink it, man. You don't want it to crash your bus and kill people and kill the kids. So once a while, but to make it a consistent habit, or to make it a habit of drinking Red Bull. As for you, every day you need your Red Bull before the day is over. No, that's what we're talking about. They are going to eventually raise your blood pressure. And the reason is that they contain these ingredients, mainly caffeine. It's caffeine, and guarana is another one that has high amounts of caffeine in them. And then there's another one called taurine, which is also found in all these. So a combination or single ones of these are found in these popular energy drinks that we know about. The 5-hour energy drink, the Monsters and the Red Bulls, and any other ones that you don't know their names. They contain either one or combination of these. And the key is that they are giving you sugar. They're giving sugar. Sugar is, energy. And then they give you caffeine, which is also a stimulant. And with a few, spices and flavor here and there, you feel like you're up there when you drink them. That's all they do. And the only problem again is that if you do it all the time, you are increasing your blood pressure, and you feed the purpose of taking blood pressure medications if you are on blood pressure medications. I don't know if you want to add anything.
Yeah, and I hear there was a story out there that some kids are drunk Monster. They drank so many of them at the same time that one of them fell dead, like fell down and died because of the heart rate and the pressure was so high. It can affect you. So if you are on medication, blood pressure medication, these are the ones that you want to stay away. You have to try and find time to sleep, just find time to relax so that you don't depend so much on caffeinated drinks just to stay awake. Once in a while, like we're saying, is okay, but to make it a habit is definitely not encouraged. Because
no, come on, man. No habitual energy drink. Drinker. 5-hour energy drink. No. Every day you need, or every 3 days you need 5-hour. You gotta talk to your doctor for some vitamins. That is not right. Yeah. So I think we started already on how they affect blood pressure. Gifty already mentioned that they are stimulants. They are CNS stimulants, and they stimulate your entire body. Your heart beat faster, and also your arteries close up, vasoconstriction, so that you cannot have a relaxed blood flow. Your blood flow has to be under severe pressure, which then increases your blood pressure. And so, caffeinated or energy drinks and diet supplements. Oh, we did not mention that I think there's a lot of, so for the diet supplements we have something called beta orange, yohimbe, and ginseng. All these are good names that we yeah, the diet supplements, beta orange, people may talk about how much they lost in weight or using any one of these, or yohimbe or ginseng, for memory or whatever it is they took it for. But you have to remember that there is a chance for you to increase your blood pressure if you are doing these in high amounts and on a consistent basis. So if your pressure is high and you don't know why it's so high, and you're using any of these, talk to your doctor and see. This may be the culprits. And this list is not all inclusive. There are several energy products on the shelf, call them over the counter, that you don't need prescriptions for, that we can list here in the show. We're going to be here all day. We can't talk about all of them, except to say that if we're giving you the idea. So if you are buying a diet supplement, no matter how people say they are good, I've heard about some wonderful diet supplement that people can testify to, And if you come to me and you want me to recommend, I'll go and show you and see how much caffeine is formulated with it. If it has so much caffeine, you are not buying the diet supplement, you are buying coffee. And so it defeats the purpose. So you're going to be just peeing and you are always on the edge while you wouldn't know. That is where you are losing your weight from. The excess loss of water because of peeing. So it's really defeating the purpose. So you got to look on the label and see what is actually in there. Sometimes that's all you have. But compare two different products, or if all of them have, the caffeine, the taurine, or the guarana, see which one has less, and then choose the one with less. But if I were you, I'll actually stop even using those for weight loss because there's a better way of doing that, which we'll talk about later. Come on.
And some of the diet supplements too, when you have to read the label, like we talk about how to read labels, right? They have a lot of sodium in there. They hide it in there.
Because of preserving, right?
Yeah, just to preserve it. So this amount of sodium in there, though you're trying to lose the weight, but you realize that your blood pressure is getting out of control, you have to check whatever you are taking for you to lose weight, your diet supplements. Just make sure that you know what is in there, so that if there is something in there that is counterintuitive, affecting your blood pressure, you have to make sure that you cut down, you do in moderation, or you stop altogether to go for the safe ones available.
All right. So let's move on. We already discussed how they work on your blood pressure. And so with that being said, we can move on to the other ones. Come on, man. These are a special group. This is a special group of drugs or OTC. Are these OTCs?
OTC.
Oh, come on,
right?
man. No, this is not OTC.
So you need prescription then.
No, you don't need prescription either. This is neither OTC nor prescriptions. These are stuff that you need to, basically, what do you need to get these? You need to connive and confide and steal your way and hide to get them. We're talking about crack and cocaine and marijuana, ecstasy, heroin, MDMA, whatever you can call them. These are stuff that can also cause a great increase in hypertension. As a matter of fact, within short few minutes, you can have your blood pressure up the roof and you could die. Come on, man. That's what it is. You see if I have my list of all of them here. You can definitely get into trouble with these. Definitely. And you may say that you don't know how much fun we have with these. That's why you say that. I know you could get euphoria from cocaine. I know you could get some boost from crack. I know some people say that marijuana is good. As a matter of fact, marijuana, the studies are conflicted. Some of them say that initially you may have a blood pressure go up, but eventually the pressure drops. So that one is not so much. But there are others like the ecstasy. The ecstasy. Where's my list? The MDMA, which is ecstasy, right? The crack itself or cocaine, those will shoot your blood pressure up quick. If you have worked in the emergency room and you've seen somebody who has been affected by cocaine and they bring them, you will see what I'm talking about. They want to make sure that they are safe because their pressure can be up the charts. We have crystal meth, or methamphetamines. The amphetamines are prescription drugs that we use for ADHD. And if you have high blood pressure, there's always a chance that it can go up. I mean, if you are not well controlled. So most of the time they are used in children for ADHD. But if you are an adult and you're using ADHD, just make sure that your blood pressure is on point because they can raise your pressure. They can also raise your heart rate can go up. And then ecstasy, of course, that one can also raise your heart and increase blood pressure, as well as raise your body temperature, heat. You're gonna be hot. And you're gonna be talking, and before you know, you drop dead. So those are all stuff that can affect your blood pressure levels. I don't know if somebody is doing ecstasy or MDMA. Maybe they don't even care about their blood pressure. That's the key. But if you care about your blood pressure, then don't don't try any of these because obviously they with your pressure, vasoconstriction, CNS stimulation, sympathetic nervous stimulation, everything you are on the high. That's why you feel high. But not only are you on the high, your blood pressure is also on the high. And God forbid you can get a stroke. People get strokes and heart attacks and die after doing cocaine. No, I'm not talking about over a long period. They can just, even their first try, they can just drop dead because things go up so quick. But that's not where we are, what we are focused on. Our focus is on OTCs. But we just said we should mention, because if we're talking about things you can walk in the store and buy, then of course you can also walk on the street and buy these. And that's why we just wanted to mention them. All right, I think that's about it. Anything else?
No, we can. So with the labeling, um,
Oh, we're talking about labeling, how to read the
how
label.
to read a label. Yes. So if before you take any medication, if it's a new medication for you, because maybe you have been taking one medication and you are doing all right, so that's okay. But if you've taken that medication and all of a sudden you've been diagnosed, then you have to cross-check with what you've been taking if it's still safe for you to keep taking. So let's say that you did not have high blood pressure. All of a sudden, the doctor diagnosed you with blood pressure. You normally take ibuprofen for pain and aches, right? So now you have to go back and visit that if it's safe for you to take it with your high blood pressure medication. So you really have to know what you are taking. And when you are introducing anything new to your medication list. You know what you are taking and your body is used to it. If you're taking anything new, you have to take time and read the label and make sure that all the ingredients in there is something that your body will be able to handle. If you are not sure, you ask a healthcare provider. You can ask your pharmacist, you can ask your doctor. You can always write the medication that you are taking. You have to carry it with you, especially when you go to the doctor's office, and show it to your nurse, to your doctor. Let them know that this is what I've started taking. Is it okay? I think last time we were talking about taking vitamin D, right? And we suggested that you have to talk to your doctor. So anything new, if you are not sure, if the label, and sometimes the packaging is so nice and so informative, it's just that people don't take their time to read. Sometimes it will tell you any OTC medication or bottle that you pick, it will tell you if you have high blood pressure, ask your doctor. If you're taking medication, MOI medications, ask your doctor before you take it. So you have to take it upon yourself to pay attention to anything that you start taking, if it's okay, if it's going to interact with your medication. Basically, you have to know first before you start taking any new medication.
All right, and also on the same line, reading the labels, sometimes it may confuse you because, of course, you are not a pharmacist, you are not a doctor, you're not a nurse. You won't be able to understand what the label is saying. But at least we have told you a few things that you can take to the bank. If you have high blood pressure and you are buying a cold medication or cough and cold medication, make sure it does not contain pseudoephedrine or Sudafed. And then make sure it doesn't contain phenylephrine unless your pressure is under control and your doctor is aware of that.
Okay.
And then also, if you are getting something for pain, flip on the bottle and look for the active ingredient. If the active ingredient is Naproxen or Ibuprofen, you may want to hold off and ask your doctor or your pharmacist, especially if your blood pressure is not controlled or you don't know. Sometimes I ask people, are you hypertensive? They ask, can I take this? I ask them, are you hypertensive? And they don't know. So they said, no, I don't. Well, you don't know. When was the last time you saw the doctor? You didn't see your doctor and you're saying you don't know. You probably do. So if you don't know, you haven't checked, you haven't seen a doctor for more than a year, don't say that I don't have hypertension. You probably do. So in that case, to be on the safer side, pick up something that has an active ingredient called acetaminophen instead of, one of those naproxen and ibuprofen and all those things that can raise your blood pressure. So check with your doctor. or pharmacist and make sure that you are taking the right stuff, because you don't want to take anything that will eventually lead to you having. So read the labels, and if you have something at home and you want to take, you're not sure, when you read it and you call the pharmacy, you can basically tell them what the active ingredient is, or call the doctor. You can tell them, well, the active ingredient is acetaminophen. Is it good? Because my pressure is high. They may say yes, or how much can I take? They can tell you how much you can take, but without any reading of labels, you just pick up the bottle. I need pain medicine. What kind of pain medicine is it? You can't just say pain medicine. You have to know what the labeling is saying. So you may not even remember what we said, but at least if you know where to find the information, you can ask your pharmacist or your doctor, so that you will be given the right information to make the right decision. All right. So that's
And sometimes too, uh, the front of the bottle or the box just say the name. It doesn't really list the active
the ingredient.
ingredients.
Yes.
So what you have to do is to turn it over, and they have a spot for active ingredients. Sometimes they will list the active ingredients, and they'll go ahead and list the inactive ingredients. So take time and read the active ingredients. Not only the active ingredients, you can also go ahead and read the inactive ingredients, because some people are allergic to certain things,
Right.
that they take certain medication, they react to it. And it may not be in the active ingredients, it may be in the inactive ingredients, especially people that are allergic to dye and colors and stuff like that. You can get all the information on the package. Just take time and read and see what ingredients go well with you and which one do not go well with you.
Perfect. All right, all right. Before we close, we got good news to share. Our channel has been monetized. Come on, man. Come on, man. Yeah. Yes, we have been monetized, which means that if you watch our shows or our live recorded videos or whatever, and they place an ad on it, they may give us 1 cent. Sometimes, well, 0.001 cent, whatever it is. So monetize means that they can put a commercial on our stream and then cut us some of the payment for the commercial. But the way to support us, maybe you wanted to see these people are doing good. That some people have been calling us. You have been calling us and say, "Oh, keep doing it." Don't tell me keep doing it. Support us right now. Come on, man. I would like all the good encouragement, but the encouragement that would be even better is to support us. And I put on we have channel membership that we have set up on our channel. So if you want to support us as a spider or as the Anansi, the folklore of Anansi, that's where we got that name from. You can support us with $2.99 a month by going to our YouTube channel and clicking on the membership and just becoming an Anansi or a spider member. Oh, come on, man. That's a fun thing. So you become a spider member or a spider supporter. And then if you want to do even better, you could do the Kente member. The Kente is a representative of beauty. So you are saying that, you know what, I'm not just going to be a spider. Spider, the reason we chose a spider is that spiders, they spread the news. That's why the photo that we're showing is a spider's web. Spider will take the information that we give them and then they spread. And then they support us with a monthly donation of $2.99 so that we can spread the news more. So that's the work of the spider. Now, the work of the Kente is the beauty of showing us that what we are doing works. So those of you who say that what you're doing is helping me, I was able to do this, become a Kente member. And you are also showing the beauty of how health information can be to people who can actually benefit. And we have benefits to these. The Kente members are going to receive exclusive live shows and a host of others. When you click to sign up, you're going to be able to see that. And then the last membership group is the Golden Stool membership. Come on, man. The Golden Stool members. Those people are going to be supporting the channel with a donation of $24.99 a month. And because that is a lot of money, for $25 a month to support us, we are calling them the golden stool. It means that you are the ones who are going to make us able to do what we want to do more. You are the king, you are the queen. That's why we call it golden stool. You are the royal of our channel. You will become basically a royal supporter of our channel. And those people will actually have a maximum of 4 coaching sections in a year. So for those people, we set up either one-on-one or group coaching sections. Maybe it will be like on some disease state. We just talk about what we may talk about diabetes. We may talk about whatever disease state, and you will be able to interact live and ask questions and stuff like that 4 times in a year. So basically, you are getting more than what your $25 a month will give you, as well as all the other things that the other membership groups will have. You will have that on top. And so basically, as a way of saying thank you to us for showing, grab one of these memberships. We don't care which one you grab, but we just want to see that people really want to support the work we're doing, not just by saying and telling us, but with their substance. That's what we want to see you do. So I think that's that for our memberships. You have anything to add?
I think we're good.
All right, so it's been fun. OTC meds and how they affect your blood pressure. All right, so until we see you again next week, if not before, we say,
Beloved, we wish above all things that you prosper and be in health, even as your soul prospers.
Thanks for watching.
Thank you.
God bless.
God bless.